you cannot do anything in digital public health without having some sound knowledge and grounding in public health, perhaps in health in general. But then you also need to work with people who are interested and who are able to talk about technology, innovations in technology, and then already the field opens up. You need to talk about people who have ideas about privacy issues, about ethics, about law. So all that comes in very smoothly, and so this is a super interdisciplinary field.
Hello, welcome to the Digital Public Health podcast. My name is Rasmus Cloes and I'm obviously talking English to you today. That is because I'm talking with Professor Dr. Hajo Zeeb about his new handbook on digital public health. And it is also written in English and it's addressing a broader audience, worldwide you could say, that is interested in the research here from Bremen on digital public health. So that is why we record another episode in English. Hi, Hayo.
Hi,
It's
hi.
good to have you here again.
Thanks.
We talked about like 1.5 years ago about digital public health in general. Later on, you've written a book or you authored a book about digital public health. What is it like generally about? What is like the broad idea of the book?
Yeah, first of all, I have to say I'm one of the editors of
Yeah,
the book,
sorry.
and then I've also written a few of the chapters. In fact, so I'm both author and editor. But we are a group of editors from the Leibniz Science Campus who have, at some stage while we were working in the Leibniz Science Campus, developed the idea to say, okay, it's all digital what we're doing, and we're talking about this a lot in the digital field, but we still need something perhaps where we summarize things under a cover, a frame of a real book. In the course, we decided it will be an online book, which brings its own challenges, but it is a book and it brings together a lot of aspects, not 100%, but many aspects that are relevant for this issue of digital public health. What is it about digitalization in our field of public health, prevention, health promotion? There's so many things to think about, and we had the idea to, offer a kind of broad but also comprehensive overview.
And you started in the handbook with the question, why is it essential to address digital public health in an interdisciplinary way? What is like the key idea of that? Why did you start with such a question in the book?
Yeah, I think this is more or less also the grounding for our Leibniz Science Campus is also very much in this field or idea of interdisciplinarity. You cannot do anything in digital public health without having some sound knowledge and grounding in public health, perhaps in health in general. But then you also need to work with people who are interested and who are able to talk about technology, innovations in technology, and then already the field opens up. You need to talk about people who have ideas about privacy issues, about ethics, about law. So all that comes in very smoothly, and so this is a super interdisciplinary field, and I don't see any other option than to do this interdisciplinarily and working really with a number of people who might not always work together, but here they have to work together.
So it's quite broad, the general idea. Are there some like connecting points, especially when it comes to entry points for digital public health? So what are like key issues for entry points?
Yeah, I mean, what we think is that digital public health, to really think about it, you have to first of all embrace the idea of public health. What is it, and why is it important for our societies and for health in general? And then to think about, we don't want to change the field of public health as such, but we need to realize and to understand where does digitalization actually come into different aspects that make up public health. So it's really identifying those points, be it in terms of research, be it in terms of communication, be it in terms of transfer, that really then are the issues where we talk about this getting together of digitalization and public health. This is what this chapter about the entry points is all about.
For whom did you write the book?
Yeah, I think there are various audiences. First of all, it's for our colleagues and peers who are working in the field, because I mean this is also from where it comes, the book, written with them and for them. But we kept it, at least we tried, also general enough to open it up for interested parties, maybe, yeah, students, for example, in our fields, but also the general public, if they have a certain leaning towards, understanding what is happening there, because they are being confronted with, all these apps and web pages and digital information that is out there now. Their doctors are turning digital to some extent. So individual chapters will certainly also be of interest to people who want to, better understand what are these people talking about and what is it they are doing. So from, interested public to our science community, I think it's a kind of broad field.
You chose to write or edit more than 500 pages.
Hmm.
Why did you do it in the beginning?
Yeah, I think we had this idea of bringing the various and many different disciplines and various people together in our Leibniz Science Campus on digital public health here in Bremen. This posed a very good opportunity to give everybody a certain task coming from their piece of, land where they're working, and then bring it together in one larger volume. So we used it to, identify the areas we're working in, perhaps show first results, and then also use it as a linkage to colleagues elsewhere, because several of the chapters are written by colleagues from outside with whom we have certain interactions. So it's a nice mixture of getting the community together with whom we are working, at the same time showing up what we are doing and also showing results of our work in the campus.
Um, Public health is a lot about equity, equality. Uh, how is the digitization changing, yeah, the equity in public health? Like, are there new challenges coming up?
Yeah, there are many new ideas, no new challenges. First of all, you could argue digitalization is a great democratizer, in the sense that it's getting very easily accessible. Most people are able, even worldwide, are able to access the internet now. Simple tools, even relatively affordable, are available to many people. But on the other hand, as we move on with digital technologies, it's really so that things get reliant, for example, on digital health literacy, and the more, advanced tools also then, will cost money to some extent. So there's quite a chance to leave people behind. We have elderly people who might not be so interested in this. Now, if we have a big transformation towards digitalization, obviously they might not be able to follow, and they might also not be able to participate, because it's also about interaction. And again, if you have only certain people interact with the development of technology, you are not perhaps responding to the needs of everyone. And public health is about really getting the best of health to everyone, really.
Yeah, you addressed the point of money, you could say. So we all know that there are big players in the digital world, yeah, becoming big players in the field of digital public health, maybe as well. Um, how can public health be like still free in this digital world? Is there like this point addressed in the book?
It is partly addressed across the chapters. For example, really also showing or discussing the limits that this all brings. As I mentioned, there are some groups that might be not so interested, and we also need to cater for them in public health in the future. And people, for various reasons, would not want to share any data, for example. So, do we leave them out? No, we need to still work with them and really get the best out of everything for them as well. So there's a big issue around integration and being comprehensive with our digitalization in public health.
Mm. Another issue I think you addressed in the book is the problem, for example, in forecasting health problems. You have always these, you want to have really precise information about persons, and you also need to think about data protection. I think that was also addressed in the book. Can you
Oh
elaborate a
yeah,
bit on that?
yeah. I mean, this is one of the new opportunities, one can say, in digital public health, but also, yeah, a bigger problem, in the sense that obviously we are able now, with various means, to collect much more individual but also contextual data. And this obviously, may allow to identify people as they live, as they perhaps use healthcare, as they maybe, arrange their lives. And this is the big issue of data privacy. And we have quite a number of chapters that really deal with this. And, what are the requirements? We obviously have in Europe, the GDPR and other regulations. These are all becoming very relevant for us. And at the same time, you don't want to lose the benefits. So it's really a bit of a playing out of the different directions that is needed here at the same time. It is something that needs to be done, because if we, for example, do not take care of data privacy, people will lose trust very simply, and it has already happened at times. So this is definitely a core issue that needs to be tackled and addressed.
You've been talking about these new challenges, you could say. So, what are new skills people, citizens, need to have to like make meaningful use of digital health services, for example?
Yeah, I mean, at the core probably is digital health literacy, as one may call it. There's a chapter on that as well. It's somewhat an individual concept, but really to evolve well, you need also institutions that are digitally health literate, and you need to have support systems. So that is definitely very much required. I mean, the technology needs to be there. The structures that are needed have to be in place, and that is also different across countries. But we are now seeing a lot of move towards digital health tools in many ways, also in the healthcare system, and so this is really becoming more and more ubiquitous. I would say it's everywhere, and one needs to sort of tease out the ways that really advance health, and some of them probably will also get lost over some time, because not everything will stand the test of time in this field.
Um, we're talking about opportunities, about new challenges, uh, but what are the limits of digital solutions? I think in one chapter you talked about like what are like maybe not digital solutions.
Yeah.
Is also something you address?
Yeah, I mean, it's quite clear one shouldn't follow the hype of digitalization to the bitter end in some ways, and then forget about analogous solutions. What we see, for example, in our research also, that what our colleagues and friends from technology might say, the human in the loop kind of thing is in healthcare very important, because, for example, if you think about translation systems or apps that offer certain services for health, many times, for example, in mental health, there is a system that you have sort of your digital tests and exercises and sessions, and then at some stage you will talk to somebody, either online, but with a real person, or even have a personal meeting. And these things will still be there in the future. They are important. They remain important. And as I said, we have certain groups who really prefer also talking to people and interacting with people in a traditional way, and not using digital tools. Sometimes a little bit of digitalization may sneak in there as well, and that will be fine. But it has to be steered by those people who, who are actually, interested in doing this, and want to improve their health and their healthcare. So it's up to them really then to choose how far do we go with digitalization. So it's really this steering, the governance of all of this. How far does it go, and where do we, remain with analog approaches and tools? And I think in health we will have analog tools to quite some extent also in the future.
You said there's kind of a like, huge approach you've chosen. I mean, it's quite a long book. It's quite. You have chosen a like multidisciplinary approach. You touched nearly any chapter of digital public health. But is there something you say, that is missing in the book?
I mean, it's, as you say, it's a wide field, and we have certainly covered more than I think other products or books that are out there. One or two things I would be able to talk about now is certainly there's first of all the big topic of cybersecurity in health. It is coming up once, or twice in the book, but not as an own chapter. And mainly because it's such a big topic, and it really touches a lot on things that we felt we are not able to cover sufficiently.
So would need a second book.
We need a second book at least on cybersecurity in health and also in public health. there's so many side aspects and core aspects to this that we wouldn't be able to really have a sufficient answer to this. That's certainly one point which we all already saw while we developed the book. Secondly, I think also the topic of evaluation of digital health technologies for public health is not a strong part of the book so far. We have no core topic or even full set of chapters on this. It does come up a few times in various chapters, so please keep on reading, everybody. No doubt this is coming up, but evaluation will play a role because we will need to better understand what works and what does not work, and also whether we really can change those things that we apply digital public health tools for, whether we can really change outcomes and really improve processes and be more efficient and so on. So evaluation still remains something which also deserves a lot of attention.
We already started to talk a bit about the gaps of the book, you could say, but you're ending the book with a kind of a view in the future. I think it was about 10 years in the future, something like that, with
Yes,
digital public
yes.
health. What are your key takes from the actual perspective? What will change in the future in digital public health? What will come up? What are your guesses? Just a wild
Yeah.
guess, I know.
Well, we have three scenarios
Yeah.
there. I'm not divulging them now, so everybody should read and see what the three scenarios are. But they range from dystopian to very positivist, I would say. Most likely, it does look like things are moving fast, and we are seeing much more AI in the whole field across so many domains and processes. So I think the challenge is really to use AI wisely, also for digital public health in the coming years, and not get lost. Realize where are the limits, where are the strengths of what we can do. Probably we can be more efficient, but there are also a lot of issues around what we discussed, privacy and so forth, that are there. So I guess, yeah, there's some bright future for digital public health. Many open questions, so a very nice field to work on and improve, and not forget the population we're actually wanting to work with and to serve. That's at the core also of digital public health in the future.
You have written a book on digital public health, which is kind of like I think it's kind of, no, you couldn't call it a strange approach, but it's kind of I mean, the digital field is changing so fast, and you need some time to write the book. And you already mentioned that there are some points maybe lacking. Will you write another book on digital public health, or another handbook on digital public health, or will you choose a different approach next time?
Well, we'll see how this stands the test of time. So far, we are seeing that it's well received. People are interested in this, and maybe it's also quite good to have something like somewhat permanent here to say, okay, this is now the groundwork, and we can move on from that. So I would probably expect that we might not write a broad book or edit a broad book like this again. Perhaps focus a bit more on specific aspects, but once in a while, such a collection is also quite useful. So amongst the things that we'll be using, there may also be a book also in the future.
Thank you very much.
Thank you, Rasmus.